Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome to the Low Carb MD podcast. Tro, we're gonna have fun today. We got a guy that we've had a lot of fun with on Twitter, and he's almost as outspoken as you. I think you guys are in a little competition here, you know. So, Tro, how are you doing, man?
Listen, doing great, doing great. No COVID resurgence here like you guys, so we're doing okay. We're doing okay. Very happy to have Dr. Nick Greiner here. Okay, and very, very smart guy. I've been following him on Twitter for a bit. Some very strong opinions, but some unique approaches to care that, and I'm happy to kind of explore his own journey, his thoughts, his opinions, and bring it out to the forefront and talk about it. So very happy to be here.
Thank you both for having me. I was looking forward to this for a while. Thanks for having me, guys.
Hey, thanks for joining us. And tell people your story. Tro and I have told our story about how we got started. How did you get started on the path of where you're at now, and like let people know what led you in that direction and how you got there?
So, wow, my mother started migraine headaches, I would probably say when I was a teenager, and she had them for years. And like a lot of people, she went to several different doctors, and she had gone to, so I'm from Pittsburgh, Pennsylvania, by the way, and a lot of good doctors in this area, lots of good surgeons, lots of good primary guys and gals. So she had gone to the best because nobody goes to the worst, with no help. And it always seemed like every time she had gone somewhere, the answer was more meds, less meds, different meds, and none of it worked. She was getting probably 2 or 3 a week, and they were severe. She'd be in bed for days. And excuse me, this had gone on for years. So she eventually had made a trip to see this through friends of hers. They had told her, hey, listen, there's this migraine, the best migraine specialist in the Northeast. She's in Maryland. So she took a trip to Maryland, and she spent 3 days there, her time, her dime. This woman had a cash practice, basically. And after 3 days of, I guess, quote unquote, care with this woman, she comes in to talk to my mother, and the answer, she wrote her a script. And this was if you hear my mother tell this story, she does obviously a way better job than I do, but if you hear her tell the story, she will tell you that if she had gone to 12 doctors, and this was the 12th one that she had seen, she had never asked any of the previous doctors this question. The question to this particular woman, who was considered to be the best migraine specialist in the Northeast, was, okay, fine, I'll take the meds. I trust you, but why am I having these migraines? That was the first time that she asked any doctor why. And you know what the woman said to her? Now, this is the best migraine specialist in the Northeast. You know what the doctor said? She said, I have no idea. So you fast forward. I mean, it's and so you
we got a drug that works, right? But we have a drug that works.
Yeah, and so listen, she took the meds, right? She took the meds, and it didn't work. They didn't work. So you fast forward maybe to another year or two, and she sees a guy that says these are hormonal. Right now, in retrospect, what did I know back then, right? But thinking about it now, I'm thinking, okay, maybe now we're getting somewhere. Well, he said they're hormonal, but the reason why they're hormonal is because you have female reproductive organs, so we're going to take them out. No pathology, just we're going to take them out. Had a full hysterectomy. Now I was in my early 20s. By the way, guys, I went to undergrad for exercise physiology and nutrition. That's what I studied in undergrad, okay? So anyway,
you were drinking the Kool-Aid at a young age, huh?
I was, man. I was. And I thought, of course, I thought I knew everything, you know what I mean? And so she had the surgery done, and again, in my early 20s, I was out of undergrad at that point, and I was working. As a matter of fact, I was doing like rehab at like a cardiac rehabilitative center, and I was also like bartending and DJing and bouncing as well. But anyway, so that didn't help either. Fast forward maybe another year or two, and I'm wrapping this up here, guys. She was referred to, who in the medical community, this guy was considered to be the quack, right? This was the lifestyle guy. This was the cuckoo. This was the quack. This guy was the MD-DC, okay? So she sees this guy. She spends 4 intensive months with him. She gets better. In the past 20-some years, she has had maybe 5 migraines, right? And looking back on that, I always wonder why it took, again, I'll use the example of 13 doctors. If she saw 13 doctors, why did the first 12 not talk to her about lifestyle? Not even a little bit, right? So from that point on, I said to myself, okay, that is what I want to do. How this guy helps people, how this guy serves people, that is what I want to do. What worked was not the drugs, was her lifestyle. And I figured that's what I want to do. So I'm thinking to myself, who do I have to pay? Where do I got to go to school? If the meds didn't help, I want to be a lifestyle guy. So that's what I did. I want to have an MD-DC practice. I want to have lifestyle. I want to have multiple providers. And then, through that, my journey there, I got turned on to some other physicians, some people doing some pretty cutting edge stuff, like some of the things we do in our clinic, some of the treatments, like some of the IV stuff, major autohemotherapy, all that stuff that we do, that's not from that guy that helped my mother. That's stuff that I picked up along the way. But anyway, that's my story. That's my journey. And that's kind of why I do what I do.
So it sounds like at a young age, you were interested in nutrition and you're interested in lifestyle, that you already were called to it. I mean, and then you saw mom suffer, and
Yes.
then you saw mom suffer and get better. Can I ask what was it? What were the lifestyle changes mom made that helped her migraines? Because I think that's critical for people to hear. Because interestingly, in the literature, it's right there. It's like right there, and
Yes.
nobody talks about it. So what did mom do?
Well, first she had a bunch of labs. I know that for sure. She had a bunch of blood work done. But I also think that the guy maybe had done other things. Like I think he maybe done like some Dutch blood work, specific hormonal stuff, deficiencies. So he did a bunch of labs, and then he started looking at her lifestyle. Now, what's interesting about this, one of the things, and about exposure to certain, I guess, what people call toxins, you know what I mean? And, started talking to her about, makeup that she was wearing. And that was back then when people considered that stuff to be like, foo stuff. You know what I mean? You're talking about putting stuff on your skin that's supposed to be harmful. Like, who the heck believes that stuff? So this guy was talking about that back then. But anyway.
Wait, can I pause for a second?
Sure.
I mean, all our listeners are going to hate me for interrupting. Just to point out, because still people think that, and yet the FDA has cautioned on the use of sunscreen. That celiac groups have cautioned the use of makeup that has gluten in it because of reactions they've seen. So, the methanol that is in the hand sanitizers that we are using, that the FDA has cautioned. So this is not quackery land. If this has not come into mainstream by now, which I still don't think it has, it should be, because the FDA is literally putting it out. So it's not quackery. And I can see how back then that guy sounded like a quack, and even how you described him, yeah, that quack there, but it's maybe more of a prophet than a quack.
Right. And yeah, his clinic, he had like this small clinic in the, in like a basement of somewhere. But I mean, I get it, right? But maybe he was just like a low overhead guy. But anyway, so he talked to her about that type of stuff. That was the first time I heard about intermittent fasting, by the way, in my 20s. Smaller eating windows. Basically, he was a big paleo guy. But also too, he did like on the structural corrective side. He did imaging on her. I think that he had mentioned something like upper cervical stuff and loss of cervical lordosis. That's why the type of care that we do in our clinic, as far as the chiropractic goes, is structural correction. It's with physical therapy and neurological reeducation, all that stuff. So we're into spinal correction as far as with that part of the clinic. But anyway, a lot of those different types of things. And her sleep was always true. I mean, her sleep was always horrible, man. And it was kind of like, is it the chicken or the egg thing? Is the migraines that's causing it? Or is her horrible sleep, possibly contributing to it? So things like that. I don't think he was a big supplement guy. If looking back on it now, it wasn't like he was like pushing that stuff on people without talking about lifestyle. So it was kind of a combination of things. I mean, in my opinion, it was addressing what he found were possible contributors to her migraines. And through
Sounds
all
like
that,
somebody who actually used their head.
right. Yeah. He just thought, right. I mean, and I think that a lot of times, maybe just as an aside here, I think a lot of times people are looking for one thing to be the cause of something, right? Which is kind of why I have a little bit of an issue with people who only, and maybe this is a little bit of exaggeration or hyperbole, where it's the only problem is nutrition. There are more things potentially causing health issues than just what we're putting in our mouths. So, and this guy kind of addressed all that stuff.
So he's a quack for sure, Tro. He's a quack.
He's a quack, man.
Thinking outside the box, say, hey, this isn't working. Let's try something new. That's the definition of a quack, I guess.
What's interesting, if you look at the data, Brian, I mean, it's right there. Modified Atkins, Low Carb, decreases cluster headaches, migraines. So by going paleo and clearly reducing flour and sugar, and then look, we use seizure medications for migraines all the time.
Right.
And lo and behold, the ketogenic diet, is both anti-migraine and anti-seizure. Who would have thought? Who would have thunk?
Who'd have thunk it?
Only a quack would have thunk that, I guess. But
well, Tro, like we were called total quacks or I was, at least. I should have my medical license revoked for considering the possibility that sugar could be addictive, right? It was like unbelievable by other doctors, or another doctor for sure, and all of his followers. So you start looking and saying, okay, here's the data, guys. Look at the data and look at what we're seeing clinically. And when Christian Assad started talking about his migraines going away, a lot of people we've had on the podcast saying the same thing. Kristen, my partner too, same thing. A bunch of migraines gone. And I've seen it over and over again, and anxiety and stress and all this stuff. And it's not the magic pill, but there's a lot of people who benefit, right? And so we're observing this clinically. And Nick, the other thing that I love is that you're bringing in chiropractic too, to understand us allopathic guys, as regular docs, we just say, oh, here, your neck hurts, here's some anti-inflammatories, here's something for this, here's something for this spasm. And a lot of times it's a structural problem. So if you don't fix the structural problem, you're going to be suffering.
Right. And I think too, that's something that for me, because there is obviously a difference, structural correction versus, treatment. If somebody gets imaging done, like I said, we restore cervical lordosis, depending on severity of scoliosis, reducing it. And we're talking about if there isn't like an anomaly, like a hemivertebra or something like that, we're talking about structural issues, muscle imbalances. We do neurological reeducation, we do PT. So it's, we can get, and that's my whole philosophy is, obviously you can't control everything. You can't fix everything, I guess it'd be nice if we could all live to be 119 and a half years old and go to sleep one night with our family and, we go to heaven. Right. And by the way, I believe in God and Jesus. So, that's, I get it. But my thing is, it's about improvement, healthy longevity, not saying that you can, again, prevent everything, but my goodness, man, what people are being diagnosed with and hospitalized these days, in my opinion, that stuff, we can definitely make a positive improvement and get these trends going in the right direction by making lifestyle changes for sure. So
let's step back to one thing you said too. Where do you think faith fits into this whole thing? That's one thing that hardly any doctors ever talk about. In times like this, I see it on Twitter as how many people are just they think everyone's evil, racist, terrible. And they don't say, hey, look, I have faith things are going to get better. I have faith in my fellow man that we want to do the right thing. And that's a hard place to be. I think a lot of people are in that place right now.
For sure. And I think that, in my opinion, of course, a lot of the issues that people take with faith, at least in medicine or healthcare, is that, and I've personally seen it. I kind of indirectly attract a lot of Christians, to my clinic, but I hear a lot of these Christians saying things like, well, I'm going to, I think that you have to have a basic understanding of a couple of things, right? There are things that are responsibility, right? You can't say, I always say that I'm going to jump out of an airplane without a parachute, but I'm going to pray that God catches me. If God created physics, he also gave us a brain. And if I'm going to jump out of an airplane, I want a parachute. So I believe that we have responsibilities as well. We have to do our part, but at the same time, have an understanding and this reverence that, I believe that God created us perfectly, right? He gave us organs. He gave us organs of detoxification. He gave us skin, but he also gave us a brain. So I think in that sense that there has to be this basic understanding that, hey, listen, we have a job to do ourselves, but we're just obeying the laws that God created, with the human body. We're just obeying that. So that's my thoughts. It would be like me, I'm going to smoke a pack of cigarettes every day and just pray I don't get lung cancer. That doesn't make any sense either. So we got to do our part. Yeah.
Well, I want to talk about this because I had this philosophical moment very recently. I want to say maybe a religious moment, and help me parallel this, guys. Okay. I'm sitting, I'm watching, there's construction out of my office, like outside of my office, there's construction workers working, and they're, first of all, there's a concrete pathway, right? There's a concrete sidewalk, and they're grinding the concrete down. Okay. And it's making huge fumes of like white concrete dust in the air. Okay. And I'm thinking to myself, you know what? God definitely we know that the lungs can heal themselves, but I don't think God prepared for silica dust, right, into the lungs.
Yeah.
It's like God gave us a brain. We created concrete. Okay. We created concrete. We created the concrete grinders. I don't think that, I think we got to prepare, and God gave us the brain to know that, he's not the one who made all that per se.
Right.
And we better get our mask on. So I'm going to segue a little bit to masks, but anyway, tell me what do you think about this? Our bodies are magnificent things. They're able to do a lot of things, but we're able to do a lot of damage.
Oh my goodness.
We're able to do a lot of damage that I don't think our bodies were intended to recuperate from. So what do you think about that idea?
I agree 100%. And the fact that people are living to be 78 years old with the damage that they're maybe unknowingly doing to themselves over that time is just really evidence of how amazing the body really is. And I'm a fan of I do hormetic stuff all the time. You know what I mean? I enjoy bourbon every now and then. I sit in my sauna. I take cold showers and every now and then. And, I beat myself up 4 to 5 days a week, Brazilian jiu-jitsu. I like hormesis. But, you're right, Tro. There's things, I always say that if you got rid of man, if man and women disappeared off the planet, the earth would thrive. You know what I mean? We're the ones that kind of mess stuff up. And I'm not ungrateful for some certain, I'm grateful for a roof over my head, for, that I can talk to you guys in different states, doing this. I'm very grateful for that new technology. But a lot of things, like you said, they're just man-made stuff that our body can't handle, for sure. But I think rounding up, like I said, just my philosophy is having a basic understanding of, we have a job to do, our responsibility, eating a certain way, sleeping a certain way, moving a certain way, etc. And then, having faith and trusting how we're made as well. Yeah.
I'm going to come back. I'm going to jump Brian off here because I know he's eager.
Yeah.
So we know about those chemical exposures, those workplace exposures. We know a lot about those things, and we know that concrete dust can cause silicosis in the lungs. It's basically like a lung disease, right? So I walked out, even though there's a mask shortage and we have very few masks, I gave each one of those workers an N95 mask.
Nice.
While they were doing these things, because I believe that, protecting their lungs from that particle matter is the right thing. And I just see something wrong happening. And I spent 2 minutes and I talked to them about, you know, hey, look, this is what you guys got to do to protect yourselves. Nobody's going to come here and, you know, give you a pat on the back for wearing a mask. But you know, to prevent the kind of silica dust exposure, you definitely need it. So if you don't know where I'm going with this, you know, we're going somewhere with this. Brian, I know I cut you off, man. So go ahead.
No, I'm good. No, I'm good. I'm with you, man.
So let's talk about masks, Nick. Let's talk
Yes.
about masks. Yeah, let's do it. I want to come back to your own personal growth too, but you know, we segued right into masks. So
Yes.
tell me, what do you think? What do you think about all this stuff? And I got to tell you, some of the stuff I agree, some of the stuff I'm like, wow, I think what he's saying, but I don't want to be the one saying it. And some of it is like, you know, wait, maybe it's a little too far. So
Yeah.
what's your thought about COVID and these masks? And, you know, as somebody who's been a proponent of lifestyle and strong advocate of lifestyle and using your brain and thinking outside of the box, what do you think about masks?
So first, when this first went down, I wore a mask in my clinic. If I was out in public that required a mask, just so you guys know, for the time that, at least where I was, where there were these rules about grocery stores requiring masks, we ordered our food online. Basically carnivores for a month. I have 2 big chest freezers in my house, stocked of food. My point is I wasn't breaking any rules, right? And I'm talking about if an establishment required them, I either put one on or I didn't wear one. Now, if you want to know my big picture, I don't know how much you want me to get in deep of this. Kind of my issue with masks is that I don't believe it's about public health. If you want me to stop here, I will. And I'm not going to, you know.
I'm going to leave it to Brian's judgment because
Okay,
he's got more
okay.
gray hair than me, but I like where we're going.
No,
Okay.
I love it, Nick. I want to hear
Okay.
your opinion because I know there's like major emotions here, you know, for sure.
Yeah, I don't think this is a public health thing. Okay. I think that I see this is just my opinion, and I want to say to everybody, my opinions do not, you know, I don't want anybody to think that my opinions are your opinions, Brian, Tro. Okay, these are just my opinions. So I don't think that this is about the public health issue. I think that this is about, I think it's a test. And let me tell you why. From Jump Street, the first maybe 2 weeks, I was keeping my eye on this. All right, and I'm thinking to myself, let's see where this goes. And then I viewed this, again, just my personal opinion, I viewed this from early on as a political thing, not a public health thing. So I have always, and I have not hidden this one bit on social media, I have always thought that this was a political thing. And I've looked at it through that lens. So everything that has happened, I feel like I've been like this. I've had a magic 8 ball, and I'm thinking to myself, here's what's coming next. 2.5 months ago, when people were pining for more testing, we need more testing because it'll drive the death rate down. Well, the death rate was already very low, and I'm thinking to myself, okay, well, they want it to be 0. So, and now everybody wants to prevent death. It's funny to me. So I said to people, well, hold on a minute, and I've been telling people, go through 3 months of my tweets, and you'll find it. I said, hold on, be careful what you wish for, because they're going to move the goalposts to, hey, cases now. It's about cases. And listen, I'm not an immunologist here, guys, but what I'm saying is where are them? And there are some saying it, but what's happening now? I mean, isn't that herd immunity? I mean, isn't that what we want? How did it go from flatten the curve, don't overwhelm hospitals, to schools are closed in the fall? Are you kidding me? I have a 5-year-old that goes to, I'm not going to say the school, to a private school. They're sending us emails about steps of what this color and that color. Look, I'm not putting a mask on my 5-year-old. Are you freaking kidding me? We're supposed to go on vacation to Florida for 2 weeks at the beginning of August. We're probably going to cancel that. And my point is this, guys. To me, and this is just what I'm seeing, and I pray to God that I'm wrong about this, it seems like people are just switching gears from it's a public health crisis to just put one on to appease other people's anxiety. What if I have a shirt on that offends you? You want me to walk around with my shirt off? And I just see this slippery slope, man. And again, this might sound like I'm boasting. I'm not, guys. I haven't been wrong yet about this stuff. I haven't.
I want to pause and talk about this a little bit, Nick, because I think it's actually relevant. There may be true immunologic things. There may be true healthcare, public health things. We don't know how this disease spreads. Wear a mask, be cautious. But then there are political forces that will co-opt any message, right?
Right.
I remember when Chris Christie, when Ebola hit, he quarantined the nurse who had no symptoms for 2 weeks. Absolutely no symptoms, tested negative, forced her into state mandated quarantine.
Right.
I mean, it was like the most egregious abuse of human rights that I had seen towards a healthcare worker, other than maybe that nurse that was arrested for refusing to give a potential criminal's blood to a police officer and lab work to a police officer.
Well,
So, so I think there's political forces that will always look to manipulate any healthcare situation to try to, gain power, or, maybe they believe it's for the greater good. But can you separate out what you think is a good healthcare policy versus what is like maybe, clearly that there's some sort of political manipulation and, news media focus or whatever, hysteria, whatever you want to call it. What do you think is good healthcare policy, that you do in your own clinic? And what do you think is like, this has gone too far?
I think that when you see all the people talking about the metabolic disease, and the people that are really at risk for this. And listen, guys, just so you know, I'm not one of those. I've heard some really crazy things out there. I heard people say that they don't think that it's actually a thing, that there is no virus. I don't buy that one bit, right? Of course, there are people at risk for this thing. And is the answer more metabolically healthy people? I believe so. I 100% believe so. But here's my issue with that. How do you mandate people take better care of themselves? And for me, people say, let's tax this type of food, or let's make this type of food illegal. For me, that's a slippery slope, right? Because how do you, I am a 100% firm supporter of people taking awful care of themselves. I support that. I also support the people who have they can take very good care of themselves, because what's next? Do you have somebody standing outside of your house making sure that you run 5 miles every day? At least clinically, everything that we do is lifestyle. Now, if we're talking, I don't know if you were trying to go down the road of treatment options, people argue hydrochloroquine and all this and that stuff, and Z-Packs and whatever, venting and all that stuff. Certain treatments, things that, I'm a fan of sunlight, man, fasting, sunlight, even things, for example, one of the things we do in our clinic, we do major autohemotherapy for, that's blood ozone. We do ozone insufflation. That stuff knocks that out immediately, So I don't know, man, it's tough. I think that.
What do you tell your kids? What do you tell your kids and your wife? And, what do you tell your people that you love around you? Do you say, hey, look, go outside. Don't worry about a mask if you're outdoors. But if you're going into closed environments right now, wear it. Like, what do you say? What happens in your 4 walls? How do you, that's kind of what I'm trying to get a sense.
I gotcha.
I think we all think that clearly indoor transmission is much worse than outdoor. Yeah. We all agree that vitamin D levels and metabolic health, confer some risk reduction, most likely. Right. But what do you, at the end of the day, what is Nick, Dr. Greiner, the dad, the brother, what is he telling the dude who is, to mom with migraines?
Yeah. I think that essentially it boils down to risk, right? If somebody, my mother, for example, my mother is almost 70 years old. When she put a mask on, when she's out, she wears a mask. I don't tell people to wear, my whole thing through this whole thing is, if you want to wear a mask, absolutely wear a mask. I don't tell people to not wear masks. I just tell people to come to my clinic that, by the way, following the guidelines, medical guidelines, clinical medical offices, we wore masks and we were told to. When they mandated, or when they took the mandate away, people still wore them. If people ask me to wear one in my clinic, I will absolutely put one on. I do a lot of my stuff virtually. My nurses, some of the procedures that we do, they have to be sterile environment. We follow guidelines. It's not like I'm telling people to run around not to not wear them. But here's my point, I think, is that what's Are we going to wear masks forever? You know, what about the flu? You know what I mean? Are we never not around viruses? You know what I mean? So that's kind of my thing. So I really don't know what the answer is. That's,
Yeah,
you know what I mean?
you know, I think the problem is really that we've conflated a lot of things. People just say, "Oh, it's killing everyone," but when you look at the data, I was looking at it because I'm giving a talk on the news on Monday morning, so I'm looking at the data locally here. So, who's the highest group of COVID infection in my area? Ages 20 to 29. Who has the lowest mortality rate? Ages 20 to 29. Right? When
Right.
you see the lower a number of cases, but the much higher fatality if you're over 80 or metabolically sick. So one of the big problems I've had is like, yeah, we want to avoid it. Sure, do what you can to avoid it. And
Right.
initially we were told by Dr. Fauci, masks don't help. Why? Because they were afraid that the medical system would lose masks, right? So they told everyone,
Right.
don't wear masks, don't wear masks. It doesn't help at all. Then they say everyone has to all the time now. So this is where I get messed up with science, because people say, well, it's science. I don't trust religion. I don't trust anything else except science. Well, science has been wrong time and time again, and science has been corrupted time and time again. Right. So some of these studies you look at and you go, okay, that, like, I don't know if you guys just saw yesterday, I think hydroxychloroquine, a big study came out saying cut the mortality rate by more than half.
Yeah,
And
by Henry Ford system.
Henry Ford,
yeah.
huge system.
Yeah.
And 2 weeks ago, they all said this is untested. There's no science behind this. Don't do it. It's dangerous. Your heart or no increase in arrhythmias on this study. So, and then you look and say the other treatment that they've been pushing is $3,000 per person, right? And this is like 30 cents a pill or something, whatever. So you start saying, oh gosh, are there vested interests? That's what makes me sad about medicine right now. You step back and go, is it about the money or is it about helping people?
Can we just, I just want to just talk about this, what you're saying, Brian, because it's so important. Okay. Because people don't understand how this whole system, like they just think, oh, Brian's off there talking conspiracy land. No, you know, they ran the recovery trial, right, with an overdose of hydroxychloroquine. Okay. They, you know, you know, which is insane. You know, they literally made up the data. They literally, Surgisphere literally made up the data, like outright fraud.
And the World Health Organization dropped all study. They go, let's not study this. It's too dangerous.
Right.
Stop all the studies, right?
Like,
on bad data.
And not only that, nobody questioned it. New England Journal of Medicine didn't question it. Lancet didn't question it. If they're not questioning basic things, how can you trust this system? When your CDC, you know, infectious disease head is saying, don't wear a mask, no, wear a mask, no, don't wear a mask, no, wear a mask. And then the recovery trial is a fraud, right? And then the Surgisphere is a fraud, right? How do you, as a doctor, trust the system? I can't even trust the system, let alone a layperson who can't get into the nuance of why this is happening. So guys, what do you think about this? Brian, I'm going to turn it to you, and then Nick, I really want your opinion about this. Brian,
Okay.
what's your
Yeah,
question?
you know, I think we're in a really dangerous spot. I agree with Nick that there's a lot of politics being played for sure, no doubt about it, right? Do I wear a mask? You know, if I'm in my own clinic and no one's around, I'm not wearing it. You know, I'm afraid of the perception more than anything. It's treating anxiety more for people, I think. And so it's a hard thing, like being on the campus of a Christian school. I'll wear the mask when I'm seeing the kids. You know why? Because you know, I know that they're probably at risk of having it higher than other people, but and I'm metabolically healthy, so I'm not so concerned about it. I'm looking and saying, okay, the problem is not kids going back to school. The problem is kids going and visiting grandma and grandpa. Right? If they get it and they give it to an 80-year-old grandpa with all kinds of health problems. So that's the problem we're looking at. So do you isolate everyone, or do you isolate the sick people or the people at risk? And the big problem with herd immunity right now is that we're metabolically sick. 88% of us are metabolically sick, and those are the ones who die of COVID. So the government isn't saying, hey guys, look, let's not eat comfort foods and sit in stress and watch the news and not sleep and be all these things that we know affect the immune system and how we're going to. So the way I see it is our job is to say, okay, if I get this, I want to be metabolically healthy enough. So I'm not, am I worried about dying of COVID? I have zero concerns myself personally, right? Yes. I don't live every day, live in fear of COVID, but I respect it, saying I'm not going to put myself at risk for no reason. Right. But if I get it, then I'm saying, hey, I'm going to be as healthy as I can if I get it. I'm going to be in the best neighborhood I can. You can be mugged anywhere, but if you're in a nice neighborhood in the middle of the day, rather than the worst neighborhood in the middle of the night, you play your odds, right? Yes. So I think that's the way I see it, and I'd love to hear what you think, Nick.
Nick, specifically, I want to frame that in the, you know, people think like, oh my God, these guys, you know, on social media saying outlandish things, are they conspiracy theorists or this or that? But like, look at the conspiracy theories come true. Literally, the biggest journals are publishing fraud, literally they're running trials with like almost idiotic dosing. And then their World Health Organization is dropping the use of it. Meanwhile, there's literally studies showing that it's decreasing mortality out of France and out of Henry Ford system. So how do you reckon, and then the US is buying up, billions of dollars worth of Gilead drugs. So can you help me understand, like, should I be a conspiracy theorist or not?
Well, I think like well, both of you, as you're talking, Brian, you as well, I think that I stand with Brian, specifically what you were saying, how you feel, but here's my first take. I'll answer you in a second, but to Brian's point about older people or things like that. So I have a grandmother who's 90. I have one grandparent still alive, and she's doing very, very well. I've seen her once, maybe twice in the past 3 months, and it was from like 20 feet away. So before all this, if I got a cold, if I had a flu, if I felt like I had a bug, you know what I didn't do? I didn't go around her, right? So I wonder how much common sense should be coming into play with all this as well. So that's to Brian, to what you were saying. But to Tro, what you're saying about the conspiracy things, it's like regarding the mask. So if Fauci says no masks or that they don't work, but then he says to put them on, was he wrong before? And if he's wrong, why is he still employed? And are the masks just a signal of everybody's great virtue, right? So which is which? So conspiracy theories, or whatever you want to call them, can absolutely be true, but who do you trust, right? Who do you trust? But I don't know, man. I just, for me, I feel like leaning more on common sense personally, because I feel like I have some of that.
Well, I mean, when you look at this situation with the recovery trial, with the the data out of France that's positive, with the WHO dropping it, with the U.S. buying up Gilead stocks, with of this $3,000 drug, with the Henry Ford system, with how they misdosed the recovery trial, how they published it in every major medical journal. What do you think about our medical system? Like, point blank, what do you think? I mean, you think are you proud of this? I'm not proud. No, I'm embarrassed.
I'm not.
I'm sorry, Brian. Sorry, Brian.
No. Hey, you don't have to apologize to me again. I'm on the same page. I say, look, when I step back and look at that, I get so disappointed. I get so, you want people in charge, or people. Basically, the problem with science, and this is how I've seen it for a long time, people want to justify their views. So what they say is, I believe saturated fat is bad. So I'm going to have this outcome say that saturated fat is bad. If it doesn't say that, then all of a sudden I have to go back and not publish the study, because science is the scientific method. We are supposed to say, I believe low carb is the best thing. I met this scientist, and he's a low carb guy. And so he said, I wake up every day to disprove the low carb diet. And I said, why? He said, that's my job as a scientist. Right. See, I like a person like that to say, let me show what's wrong with what I believe. And then, a lot of us, until we're challenged, I love it when someone questions me, because then I have to say, this is why I see low carb. Here's what my clinical experience, this is my life experience. And I have to justify. Instead of saying you're an idiot, like fighting with people on Twitter, I'm going to say, look, like, I love Dr. Unwin. He goes, look, here's what I'm seeing. Everyone said he was crazy giving these people this kind of diet. And all of a sudden they got better and they come off insulin. And people say, well, what was it, lucky? No, he knew what he was doing, and he saw the outcomes that weren't working before. So I think as doctors, as scientists, we have to adjust. And if in 2 years we find something better, say, hey, look, just eat fish, and that's the only way to live long. Okay, then we adjust to that, right? And until we have that data, then I won't be doing that. Especially, and we all know it as docs, we've all had these experiences. New drugs coming out, it's the best thing. It's the cure for all this stuff, and then it's a disaster. It's a disaster. It doesn't work. So I'm like, I'm not using it. It doesn't work. I don't care what the study shows. It's not working for my patient. It's the same thing we've done with exercise more, eat less. It hasn't worked. So at some point you say, okay, it's not working. Let's change course. Like Trost always says, we don't keep giving the same antibiotic if it's not helping you. Right. You change it up at some point.
Yeah.
What say you, Nick?
I agree 100%. And I think that clinicians, people that practice, that you work with patients, human beings, that I think that what we call anecdotes, I know that a scientist might not like to hear this, but who cares about anecdotes are patients. That's who cares about anecdotes. I don't know that they care. If somebody came to my clinic and said, hey, I told this story on Twitter a while back. I had an older couple come to my clinic about a year ago, and they call, they make an appointment, they come to my clinic, and I meet with them. And they sit down, they tell me between the both of them, they lost about 100 pounds. They were both reversed their type 2 diabetes, and neither one of them are on medication. One, I think the wife was 79, the husband's 82. And they said they happened because they watched Ken Berry videos on YouTube. And I was so excited to hear that. And they're telling me all this, and I'm like high five. And it like warms my heart to hear that stuff. And what a time that we live in, that you can reverse your diabetes if you listen to some videos on YouTube, if you get off your butt a little bit. And I said, I said, that's fantastic. Why are you here then? And she said, well, honestly, we want somebody that we can see annually that's not going to give us a hard time about eating bacon. And I'm like, okay, cool. Then I'm your guy. And I'm like, so who am I to say you did it wrong? You reversed your diabetes wrong. You know what I mean? Who am I to say that? It's incredible. So that more than anything, again, for me, that's what I lean on is results. And for us, listen, I have multiple practitioners. We have a bunch of different hats in my clinic. That doesn't mean that we can help everybody, right? We're not for everybody. So people care about results. And I think that's the point I'm trying to make here.
Yeah, I think I just want to come back to that. And you made a point that, somebody reversed their diabetes. What a pitiful state of modern medicine that a patient has to go to YouTube to reverse their diabetes.
Well, not only that, Drew. I mean, look at Gary Fetke. He had charges pressed against him for inappropriately reversing diabetes. What the heck does that mean?
Is that even a thing?
Like, you can inappropriately reverse my cancer, and I'm okay with that. If it's inappropriate, these people who are getting their legs amputated, and he cared enough to say this. I mean, that's crazy to me that they called him a quack and all this stuff, and these patients are getting better. And Nick, going back to your mom, I know she's an anecdote, right?
Yeah.
But this is a guy you're talking about years later. Why? Because he was the first one to say, hey, let's try something different. Let's see what works. And now she's doing better, right? So that's when you start realizing, like, okay, maybe we can't just throw drugs at every problem. I think that's what we're all saying is the body, doctors aren't going to like this, but the body has a remarkable tendency to heal itself. Liver damage, all these things that your body can, if we stop screwing it up, right? As a matter of fact, one of my favorite patients 4 years, maybe 5 years ago now, came in, cirrhosis. He had the varices, bleeding and all this stuff. And he came in to see me and he goes, hey, what's my projected life stuff? Right. And I go, it depends. If you keep drinking, you're dead already.
Right.
You're dead already. Your body cannot recuperate. You already have all these signs. 5 years later, he's hiking some of the tallest mountains in San Diego, and he's having a great time, and he's fit and active and low carb and loving life, and his joints don't hurt anymore, and his back doesn't hurt anymore, and he's having mental clarity and all these things. It's like, okay, he said, when you told me that I was on a death's door, it changed something in my brain of alcohol. I knew it was killing me. Yeah. So sometimes what I'm saying is, if you take out the insult, the things that's causing you the problems, we have a tendency. It's not that we're genius as doctors. You're just taking away the thing that's killing you. It's not that complicated.
Right.
Yeah. I want to ask Nick, I want to segue exactly from what Brian's saying into a question for you, Nick. We're talking about, the body's amazing ability to heal, particularly if you remove away things that are causing it to get worse. If you take away the quote unquote poison, or take away whatever the insult, the inflammatory insult. And again, I want to tie that to our discussion of the failure of modern medicine and the fact that patients have to go to YouTube, and that, one day masks work and the next day they don't. And, fraud and, publishing fraud in modern medical journals, and I'm going to pivot a little bit and watch how I do this to chelation therapy. Okay. Because for years, people like Stephen Novella at Science-Based News have said that this is quackery and it's incredibly insane. And then, that people are just taking advantage of people using these chelation therapies for heart failure, for example. And then the NIH was like, you know what, we're just going to do a study on this because we got to put this to rest. And then they did the study. It was a massive study. And then it showed that there was a nominal improvement in patients, particularly diabetics, who did chelation therapy for heart failure. And I don't do chelation. I don't refer people for chelation. This is not my wheelhouse, right? I don't know it. But I was so surprised, because I should have been like, wow, all these people who said this was quackery, like Stephen Novella from Science-Based News and some of these other people, they should change their tune. But instead, they kind of doubled down. They're like, no, this study doesn't prove anything. It doesn't do anything. And I know that you probably, I think I've seen tweets from you about this topic. So, this is a segue into maybe if we remove those insults and maybe question modern medicine just a little bit. Like, what do you think about that whole chelation therapy scandal or whatever? I don't know what to call it, you know?
I know what you're talking about. I think the most important thing that you said was the whole step one needs to be removing, right? And I see that quite a bit. We get calls all the time from people that are saying, I have this issue. I want to come in and see you for X service, right? But I know that you're a lifestyle guy, and I really don't want to talk to you about what I'm eating or about, you know, what I'm putting on my skin. I just want this therapy done. You know, we tell them, we're not your people. So my point is, what you're specifically talking about is causes, right? What's potentially or what we like to say, you know, upstream. We always address that. So, for example, mercury. Somebody comes in, they bring me labs, they have high mercury or lead, and that's typically the two metals that we see mostly elevated. And again, it's about the dose, right? Poison is about the dose, in my opinion. Somebody comes in high mercury, as an example. On our paperwork, one of the questions is, do you have any amalgam fillings? Yes. Okay. Well, potentially that could be a reason why. So I'm going to send you, my dentist is a biological dentist, send you a consultation to him, have a talk with him or her about potentially getting those removed. So we always address that primarily. Now, to the point of treating, maybe specifically, you mentioned heart failure. Let's say
because that I know had a huge study and that showed a nominal benefit, right? It was a huge study by the NIH.
Right.
But the NIH did this study. We're like, we're going to put this quackery to rest. The NIH does a study. This was published, I don't know, 3-5 years ago. I don't remember exactly how long. And then the trial was positive. And like all of these people who were like, EDTA and chelation therapy for heart failure is quackery. And I was in that camp.
Yeah.
I was like, that stuff is crazy. Nick Greiner's insane.
Yeah.
Right. And then the study comes out and it's like, what just happened?
I think I'm sorry, Joe, go ahead.
But those people never went back and said, maybe we were wrong.
Well, I think a potential issue, if I'm being honest here, is I thought, like you, listen, everything that I learned, I had to learn at some point, right? And I love being wrong. Let me tell you why I love being wrong, because it means it's an opportunity to learn something. So I think there has to be physicians, healthcare providers have to be careful with using a this for that type of a situation. For example, if we do EDTA, IV, or oral on somebody, there's health history, there's labs, we're talking about removing causes, there's, it's always warranted, and making sure there are no contraindications, that it's always safe, first and foremost. But what we're doing is we're saying we're doing chelation therapy for the metals, right? We're not treating heart failure, because what happens if somebody comes in without heart failure that has high mercury? So we're treating the metals. We're not treating your heart failure. So I think that, and I've seen this personally, other physicians are saying, hey, I am treating your cancer with some therapy, whether it's major autoimmunotherapy or high dose of ascorbic acid or glutathione, which, by the way, potentially can be harmful in certain cancers. So I think that we have to draw this parallel between we're addressing causes by removing them primarily, but also the treatment is for the cause, not for the effect.
Yeah, absolutely. But I was so surprised, particularly because this is an alternative therapy, and I know that you use it, and it's something. If you look at the literature, I know, and the problem, I think the real problem is certain doctors, true quacks, have taken these things and charged patients exorbitant fees for things they didn't need.
Right.
And use that experimental banner. And I think that's why people like Steven Novella exist, at Science-Based Medicine and Science-Based News, because there's some people who are truly, snake oil salesmen. And then there are people like you who are like thinking, all right, wait, maybe this is not appropriate. Maybe there's other things to address. What I found interesting was that it's very hard for this convention to reanalyze things that they've ingrained into them. This massive study came out, I don't know, it was 2015, and it was mildly positive for heart failure in diabetics, and EDTA is not FDA approved for heart failure, but this was a huge study that showed some nominal benefits, and nobody was there, and it's by the NIH.
Right.
And nobody was like, maybe we should like look into this further and reanalyze it. Brian, what do you think? Do you know about, I don't know if you know, did you know about this, Brian?
Yeah, and I know about it, but I haven't really had any experience. You know, I think exactly
I don't
what you're
use it
saying, though.
either. Yeah.
I think people go over the edge and they say this is a cure for everything instead of saying,
Right.
okay. So I think what Nick's saying is that, look, if I can help you with this modality, I'll help you, right?
Right.
And it's not like I don't even know what it costs. It's not like it's costing $50,000 to do this kind of treatment, right? And so,
No.
you know, so there's a lot of greed. That what I see is this, and I think this is where when we say is our medical system a disaster or not. I think us frontline docs are kind of like the infantry people, right? In the military, the generals sit in their little desks and they're air conditioned. They make decisions for you, and then you go out and you carry out those decisions. So I think a lot of us on the front lines, a lot of docs on the front lines, are just saying, okay, I'm told this is a problem, so I have to address this problem. Like diabetes, we have to get the sugars better, so we have to give people insulin, and we have to get people because they're so focused, they don't understand the physiology. They just say, okay, there's a number I got to treat. And those of us who've been around a little while, you know, and that's why I kind of sit back and I laugh, because when you were talking earlier, Nick, I was thinking, I used to think I knew it all at some point in my career when I was a young doctor. I think, okay, you just do this and this and then everyone gets better. And then you realize I don't know anything after a while. And I've got to change my tack because it's not working. What they told me doesn't work. And I think this comes back to the value of us frontline doctors, because this thing with hydroxychloroquine, it really caught my attention because a couple of doctors, like Dr. Urso, was out there saying, BS, I don't care what the studies show, I know what I'm seeing clinically. Right. So when you say I'm seeing people improving and I'm not crazy and every time I'm using it, they're getting, or whatever, then you say, those are the guys who went after these studies and said, this is BS, there's no way that it's not working. And so they stood up and they helped the rest of us, because then they went back and if they didn't raise a stink, no one would be looking, no one would be questioning, I guess, what we dropped these studies. So I think it's one of those things you have to, you know, I always say, like Tro always says, I say, trust but verify. Okay, right. I see what everyone's saying, but let's see if it works. And that's why I think it's so disheartening when we have patient after patient after patient who are improving, and people say these guys are quacks, they're crazy. But their patients, why are their patients getting better? Right. It's the same thing. I mean, we had the same arguments. And I was just on a vegan podcast, and he goes, "What about the vegan doctors who have improvement?" Great, they're cutting out the processed foods too. We're basically on the same page as which end of the spectrum you're going to be on. I think we're agreeing. We're not fighting. It's say, hey, if you're vegan and you're happy and you're cool and you're mentally healthy and you're emotionally stable and everything's good, cool. I don't have any problem, right? If you're carnivore and you're mentally stable and everything's good, and you're feeling great and your body's better and you're not diabetic, great, right? Because we know our battle is against diabetes and metabolic disease. Whichever approach you want to take that works on that, I don't care. If people are getting better, cool. If they're not getting better, then you got to adjust what you're doing.
I agree. And I always say that, you know, I learned, you know, my wife and I came out of school and all this debt, like, you know, most people do. And, you know, you started practice. And like I said, from early on, we had our heart set on how we wanted to practice. You know, this, for me, it's been 20 years and I've been in practice for 13 years and we've been integrated for some time now. But I learned most, and I can say this confidently, I learned more from my patients than anybody else. I learned in school how to pass boards, pass OSCEs, and, you know, all that stuff. That was fine. And I'm grateful for it. But I learned the most from my patients, and that's facts. That's hardcore facts right there. So, but like you said, is it working or is it not working? You know, to me, it's about results. And I call what I like to call, you know, people will say this to me. They'll come in, they'll say, you know, Nick, I got to tell you, I'm glad to be here, but I really, really, really loved my old doc. And I'm like, you know what I ask them? What'd you love about him? You know what they'll tell me? It was convenient. It was close. Everybody in my family went there. They remember my kid's birthday. The bathroom had nice smelling soap. You know what they never tell me? That they got me better, or they helped me get better. And to me, that was kind of a big wake up call. Like, you know, I made a little bit of a Twitter video the other day and said, listen, man, if you're stuck in your paradigm and it's not working, you have two options: send them to somebody else, or you yourself get better. It's simple as that.
Yeah, I saw that. I love that video. It's so true. It's so true. If I can't, that's why a good doctor should never be offended by a second opinion. Go get a second opinion and see if I'm doing something wrong, and let's see if we can learn. I think that was a huge point we had on this podcast. I've learned a ton. I want to be on this road if it weren't for one of my patients. One of my patients got me on this road because I looked and I observed and I said, he got better and it doesn't make sense. Let me look in to see why this happened. Instead of saying it doesn't work and you lost 40 pounds and you feel great, alternate day fasting, intermittent fasting, and I have to look at this crazy Jason Fung guy. And then I go through this whole pathway that all these our listeners know about. But you say, okay, let me be open to that. Let me just sit back and I remember I laugh because I'm like, if Jason Fung is right, I am going to be really pissed because everything I've been told has been wrong, and everything I've tried for all these years, the torture of Melba toast and rice crackers with a little bit of peanut butter on it, and fruit juice smoothies every morning, and all that stuff. I was like, I'm killing myself, right? So it's one of those things when you start stepping back, and I think that's why when you have clinic, that's why Tro and I had the courage to do this podcast, because we saw it in ourselves, we saw it in one of our patients. Say, okay, we have a responsibility now to say stuff, and I think. I think today we covered a lot of topic, and I think, again, we always have to do a disclaimer. We're not giving people medical advice. We're not saying don't wear masks. We're saying, look, at some point you will be exposed to something bad. The better you are going into it metabolically, physically, spiritually, mentally, the better off you're going to do going through it, right? I mean, some people get cancer and they go through it very well because they have a positive attitude, say, I'm fighting this thing and here we go. Other people just give up and they go, okay, I got cancer, I'm dead, right? So I think the mental part of it is something we don't look at, and the emotional part and all these things. But, again, we're not saying no one should wear a mask. We're saying be responsible. If you're around an 80-year-old or you're going to be around people who you're going to expose, and I don't know. I mean, is there a benefit if Tro's wearing a mask, if I'm around him and I'm asymptomatic, for me wearing a mask too, that I decrease his risk of getting it from me? I don't know. Right. I don't think we have data on any of this stuff, but we just are like, we react with fear and we say, okay. So I said, from the beginning, I said, don't fear COVID, but respect it, right? Sure. Respect it, and don't live in fear. Like, oh my gosh, if I get it, okay, put yourself in the best position of surviving it if you get it, right? I think that's Tro. I mean, where do you stand on all this stuff?
Look, my bottom line, I wear a mask here. I have a mask right here. Okay. Out in public, I wear a mask. If you ask me, is it doing anything for me? No. Is it decreasing the anxiety of other people? Probably. Is there potentially a role for decreasing transmission if two people wear masks? Probably. What do I tell my patients? Wear it, protect yourselves, protect people that care for you, but go about your business and drop the fear. Yeah. Go about your business, go outside, have fun with your kids. My kids don't wear masks when they're running around playing outside. Right. I saw two people walking down the street. They've been cohabitating for months. They're walking in the open outdoors, nobody in sight, and they're wearing masks. I don't understand. Right. You're going to go to the supermarket and there's like crowds of people. Damn right. You wear a mask, they wear a mask, and maybe it'll help. Probably it'll help. So
yeah, I think my take on that is 100%. If I don't want to wear a mask, I just won't go to a place that requires one. I guess that's my thing. I think that sometimes people on Twitter think that I'm walking around in places, with my chest puffed out that are requiring masks. I don't wear masks. I go from my clinic to home to my Brazilian Jiu-Jitsu Academy. That's pretty much all I do. I occasionally, maybe once a month, go visit my sister. She lives, I'm a little bit north of Pittsburgh. My sister's a little bit south of Pittsburgh. But that's pretty much what I do. You know what I mean? But as hardcore as I mean what I say, but at the same time too, I'm not running around and, breaking laws and rules.
Well, I think the thing is, Tro,
can we come on, man. Brian, let's do one more. I know I got to defer to elders, but hold on. Let me just get one in, okay?
Let me tell a joke real quick. I was just saying, if I look like Nick, I wouldn't want to wear a mask either. For me, I'm like, man, I've been waiting for this look. I've been waiting for this look for a long time, man. These good-looking guys, like, man, I look good. I don't want to wear a mask, and I'm like,
DJ
man.
And a bouncer, man.
Yeah, it's just good lighting, man.
Yeah.
I was just thinking how mad people would be if you just you spend like $30,000 getting your teeth done, and now you got to wear a mask everywhere, so you can't show off what you just did. I mean, that's brutal, man. Yeah. Sorry, Tro. Go ahead, man. I had to get
the virtue signaling, though. So
oh gosh.
Oh my gosh.
I think that's the other part of this is somebody wore a mask on Twitter and it had a flag on it and said wearing a mask is patriotism, and then another person said how dare you. Another doctor said to me, how dare you tell people that as a medical intern you refuse an influenza vaccine? And I believe in influenza vaccines for many of my immunocompromised, sick, elderly patients. And I recommend it to all my patients per the guidelines, actually. Yep. But when they ask me, what's your opinion? I say, I don't take it. So, and I received a lot of hardship for it. So the virtue signaling of like, you have to wear a mask and, you have to take this and that, and you have to do this and that. you know, where were these doctors when they were having medical conferences from the months of October to March every single year when influenza season is crazy, and they're telling me to wear a mask? And, you know, where were you guys, you know, in the middle of flu season doing, you know, spreading viruses? Where were you guys? So what do you think about the virtue signaling that I'm doing back to them?
Well, to your point there, my wife was just giving me the data last night. I got back from the clinic, and off the top of my head, you can fact check me on this, but the most recent really, really bad flu season, I think maybe was 17 to 18. I don't know if that's right or not. But she was just saying off the top of her head, she had read it, but she didn't have it in front of her, something like 3 million cases, you know, maybe 60,000 deaths in that time. And, you know, when do we track? The CDC tracks from November to May. Is that right? Or October to, and I'm thinking to myself, and that's exactly right. Where has that been our entire lives, the whole flu season? So that's the first thing. But here's, like I mentioned this before. So all these public health officials, regardless of state or who we're listening to, they're telling us masks and they say no. So again, are you wrong that to not wear them when you told us not to? And if you were wrong, then that, in my opinion, that means that you should be fired. But if you're wrong, if you're telling us to wear them, is that just virtue signaling? Is that just a signal of your great virtue, right? So I don't get that. I saw something on Twitter yesterday, and everybody's kind of busting Twitter's chops about, you know, the edit button. And I always make grammatical errors, and I just kind of ignore it. But I saw that Twitter's actual account tweeted, they said, "We'll give you an edit button when you put a mask on." And I laughed at it. I thought it was funny, but I'm like, hold on a minute now. Like, this is.
I would put on a mask for that.
I mean, can I get an edit button? Like, I might wear a respirator for all that. Yeah. But, you know, so yeah, I mean, listen, I don't get it, guys. I really don't, right? And I always tell people I'm the type of friend that you want. Right, I'm the type of guy that you want to have as a friend, but I don't know who to trust here, right? That's my problem. I don't know who to trust.
That's a problem. We all don't know who to trust.
Yeah, and the problem with that is, I always say that people can live in whatever fantasy land that they want to live in, Brian, as long as it doesn't affect me, right? And I feel like it is now. So are the masks for public health, or is it to make people feel better? I don't know which one it is. Is it both?
Well, I don't know. You know, it's funny because Dr. E just put something out. He put a cartoon out that said, you know, the person said, "When do you think COVID's going to end?" The doctor goes, "I'm not into politics." Right? Meaning it's political. I mean, a lot of it's political, but you know, as a politician, you had to overreact. The ones who didn't, and if they had a higher mortality, then they would be.
Yes, I agree. 100%.
Politically, you had to initially, but then you have to reassess and go, okay. When the data came in from New York, I was like, wow, I was stunned by that. 66% of the people were people who were homebound that weren't going out, 66%. And we know it spreads more inside. So you sit inside and be fearful, and everyone comes, your family comes to visit you. That's what happens. We go, oh, it's my family. I'm not going to wear a mask because I love you. Okay. And then you just killed grandma, right? So it's one of those things where you say, okay, but if I'm, you know, if you're out hiking in the middle of the wilderness and no one's around you, you're going to wear a mask. I mean, it doesn't make sense, especially when we don't show transmission outdoors. You know, I mean, you know, no one knows. One day they say it's very, 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 very unlikely that someone asymptomatic is going to give it to you. Then we say, well, we're going to walk it back. We don't know. Right. Well, which one is it, guys? Right?
It went from, you know, kill it, you know, keep the curve flat, keep the strain off hospitals, to killing Greine. And then this is kind of where my mind started going of, oh, hold on a second. Now is it about preventing death? Because if it's about the numbers, I saw, and by the way, I'm not necessarily a fan of Dr. Oz, or I don't feel a type of way about him either way. Or Dr. Phil. People say they're not real doctors. I mean, I don't know. But they got a lot of flack a couple months ago, but they were saying you don't shut down the economy for, you know, car accidents. And people, they got a lot of flack because car accidents aren't contagious. And I understand that. But
look how car accidents went down, right? Look how car accidents went down now.
Right.
Insurance companies are handing money back to you because car accidents are down. So wait a second.
Yeah, and but then it's also like, are we talking about number of lives, or are we talking about virtue signaling? Is it about a life? So you mean to tell me you're going to celebrate, here's a real quick story. I have a woman who works at a local nursing home in my neck of the woods, right? About a month ago, she comes in to see us, and she says, I have good news. We have yet to have anybody die of COVID. In the same breath, she says, but we did have 7 people die of pneumonia. And I'm like, well, hold on a minute. What? So are we celebrating the 7 deaths as long as they're not from COVID? Like, what are we doing here? Is it about lives or is it about virtue? I don't get it. Somebody tell me the rules. Because here's the deal, Tro. If you tell me to play by the public health rules, I'll play by those rules. If you tell me to play by the virtue signaling rules, I'll play by that one too.
Yeah, I'm with you. I'm with you. I can't look. This was a great discussion,
Man,
Brian.
Nick, I know. I'm looking at the clock saying, dang it, man. I mean, these podcasts, I get so annoyed, but I'm like, please, because I looked about half an hour ago. I go, we got so much time. This is awesome. And then all of a sudden, I'm like, oh my gosh, we have another podcast over this. But Nick, I've always appreciated your sincerity and your willingness to step out and go, okay, look, here's what I'm seeing. And I love that. I love people like that. You know, I got my friend Tro here, and he's not afraid to say, and he backs it with data.
Yes.
You know, I mean, you back it with data. Go, here's my clinical experience. Here's what the numbers show. And I think that's what we have a responsibility, not just to drink the Kool-Aid and say, okay, everyone has to have vaccination for everything. It's like, well, because it's always intrigued me that all the low carbers for some reason gets called anti-vaxxers. Like these guys are all crazy and they're against all vaccinations. I don't think that's what anyone is saying. I think it's more saying, okay, here's the numbers. It protects you 10% if you get the vaccination. Right. 10% maybe, whatever, depending on the vaccination, of course. Tro and I have said some are effective, some aren't effective. Zostavax was not very effective.
You know what? No doctor had any issue saying don't take Zostavax. So right. I'm anti-vaccine. I am. I'm anti-Zostavax, which had 50% efficacy. I'm anti an influenza vaccine that's 10 to 50% effective. Right. I'm actually very pro-vaccine.
Right.
You know, I'm very pro-vaccine. Every single patient gets.
Yeah, I think you look at the numbers, and you can't say it's a blanket statement. You say this vaccination in particular. Here's the data.
Vaccine.
Right. Yeah. That's
pro-vaccine.
Exactly
I am pro-vaccine. I'm not ashamed to say it.
Right.
I'm pro-vaccine. My kids got Tdap. My kids got the strep strep vaccine. Yes. So it's not. I got no skin in the game here. We recommend it, but that's the thing, right? Brian, I interrupted you. I'm sorry again. It's like we have opinions. It's not like we're going to talk about it, and it's based on evidence. Right. You know. So sorry, Brian.
No. That's totally true. That's just the point I wanted to make. And Nick, just thank you for coming and joining us. I love sitting down with a couple of docs and just talking about what we're seeing in different parts of the world too, right? Because Tro and I had a different view on some of the COVID stuff because of what he was seeing and what I was seeing were two different worlds, right? I mean, and I think it's good to say, oh, I get it from your perspective, Tro. They got decimated right back then. Now we're starting to see an upturn, but you have to really look at for me, I'm looking at the data saying, wow, that's very intriguing because again, just as they're saying cumulative deaths and they see it going up and up. Of course it goes up and up. Cumulative deaths is never going to go down. It's never going to go down. So the thing is that's there for a reason to scare people instead of saying, okay, we're seeing more cases, but what's the mortality rate? And the thing is, like you said, Nick, it was flatten the curve so that we didn't overwhelm our healthcare system because people are going to die. That's just part of what we do, right? So just recently, Orange County registered 9% of the ICU beds are filled. 9%.
Yeah, in Texas it's different, and back when this issue was hitting really in New York, we were nearing like 70-80%. So it was scary for a minute, and I think that's regional approach. You go based on the regional approach.
Totally. Yeah, exactly. Yes. So when you make it a nationwide, that's the problem I have. You look at Idaho, you look at like Montana, they had like 2 cases. I mean, right. And you lock down their whole economy and let these guys say, hey, we'll sequester the people, like, that are sick. So anyways, we're not experts on population, but I think we all agree on that. It's you look in your local area and say, okay, here's a problem we got to address, guys. Right. And so you don't make a blanket statement for everyone in the whole world to do it. If they don't have any cases in a certain country, you just say, okay, all right, you guys are doing pretty good down there wherever you're in Australia. So anyways, Nick, thanks. Tro, you got another podcast in 2 minutes, man. I knew we'd run over, man. I love it. But yeah, Nick, thanks for joining us. Everyone, thanks for sticking with us. This is, I think we didn't talk about sex, but I think we talked about every other controversial topic on this one. But I think it's important that we kind of just be real and talk about stuff. And again, we have to give the caveat: this is not medical advice for everyone. Talk to your doctor, and hopefully with time, your doctors are coming on board and understanding. Tro and I have had some outrageous emails that were incredibly awesome, you know, tear provoking from doctors who've changed their lives, right, by listening to us. And that's kind of cool, right?
I appreciate you guys. Thank you so much.
Nick, thank you.
Tro, you close us, man.
Nick, thank you so much, man.
Thank you,
We
guys.
could talk. We're going to have you on again. We'll talk more
Appreciate it.
about the science. We'll talk more about what you're doing clinically, because we know you're doing great work. So very happy to have you here. And it's like we need another hour. You know.
And Nick, how do people get in touch with you?
So my website is GreinerHealthSolutions.com, and then I'm just on, if you want to chat with me, I'm just on Twitter at Dr. Nick Greiner.
And are the Steelers going to play this year or not, man?
Boy, you know what? I don't know. I honestly, I don't even pay attention the last couple of years. I've transformed from a fanatic to just a casual fan.
Yeah, me too, man. Same thing. It's amazing, but I just kind of got tired of the politics, and now we don't know if we're gonna have fans, and there's gonna be two guys running the ball that got COVID.
Virtual football.
Yeah, virtual football. That vibrating table thing that the players go. Okay,
Oh, yes.
Steelers won.
Yes.
The Chargers would actually vote for that. That would be good for them. Like, we want to play that one on the table. We'll put our guys out there and vibrate the table. Tro, you might not know that game. You're too young, but
No.
it's all good.
Why? You know what? This is awesome, man. I can't wait to do another one of these.
Yeah, thanks,
Thank you,
Nick.
guys.
This is a
Appreciate
great
it,
hour.
guys.
Thanks so much. Appreciate it.
Yeah. Thanks, guys.